sclerosis. I work a lot to try to get more awareness out about Huntington's disease, which is one of the far more rare ones out there. But there's a huge umbrella that this covers. And the medical community has learned to manage symptoms of some brain disorders. But either way, dealing with Parkinson's disease and a lot of these problems winds up becoming a family challenge because of not just what we don't want to call caregivers anymore, but care partners. And that's a distinction I just learned about from my guest, Dr. Duarte Machado, neurologist with Hartford Healthcare. Good morning, sir.
Good morning.
Glad to have you on the show.
Oh, thanks so much.
And I love learning about new things, new sort of nomenclature and terminology. And you did. You drew that distinction between caregiver and care partner.
Yes.
Why don't you start by talking about why that is?
Sure, yeah. So with care partner, this is someone who ultimately becomes the coach for that person and helps coordinate that person's care, because when dealing with a condition like Parkinson's, it's not just going to be a single physician like their movement disorder specialist. This is going to be a team approach involving other people like a physical therapist, occupational therapist, speech therapist, a social worker, a neuropsychologist. And that care partner is on this journey with the patient, and they have a shared mission to improve symptoms and quality of life as much as possible.
You mentioned the social worker, and I forget,
yes.
Did you say psychologist or
yes.
psychiatrist? Either way, talk about that end of it and what sort of services they provide, not just to the patient, but to the care partners.
Yeah, so those individuals help the patient really from the point of diagnosis to understand the condition, provide resources to the patient, and then is with the patient and their care partner throughout the journey. So as new needs arise, so for example, if it gets to the point that the person can no longer safely drive a motor vehicle, that's a transition in life that our social worker can assist the patient with, and the care partner. So the care partner then adopts these other multiple roles, and it's important to have that network. At the Chase Family Movement Disorders Center, we have this whole comprehensive network approach with all these providers to really help patients each step of the way.
And you mentioned 5 different locations around the state, all corners and the center.
That's
Please
right.
tell us where those centers are.
Yeah, so we're in Cheshire, in Vernon, in Mystic, in Stamford, and in the Torrington area, Winstead.
Okay, so say somebody in the Secretary of the State's position is coming in, a very recent diagnosis. What are the first sort of steps a person like that can expect as a care partner when they walk into one of those centers?
Yeah, the most important thing in that initial visit is empowering that patient and their care partner with education. To say, these are the modalities that we can implement, not only when it comes to, medications and treatments in that way, but the importance of exercise, of nutrition, of getting proper sleep, of rest, both for the patient and the care partner. So empowering them with education is most important. Educational materials that we produce ourselves, that the American Parkinson's Disease Association produces, the Davis Finney Foundation. They have a wonderful guide for caregivers. So these are really valuable resources that patients can turn to throughout their entire journey. And again, it's a very comprehensive model of approach that these patients really need.
So a very wide perspective, not just for caring for the patients, but also caring for those care partners. Because I imagine with a progressive disease, the demands on the care partner start to grow and compound over time. They need that help. That's why Dr. Machado and his team and all those places at the care centers are there to help people. God forbid you're ever in that position, you can get that help too. Doctor, thank you for taking the time to join us to talk about this whole effort.
All right, thanks so much.
It is great to learn a lot more about it.